Hello, and welcome to today's virtual Hinckley Forum. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley Forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. Today's forum is presented in partnership with the Center for Latin American Studies. The Center for Latin American Studies, a Title VI National Resource Center, serves as a hub for Latin American-related activities at the University of Utah, involving teaching, research, and community outreach. CLASS provides faculty with the resources and intellectual environment to realize cutting-edge research and works with campus community partners to develop exceptional educational opportunities, courses, public events, study abroad, and internship programs for students. We would like to thank our streaming sponsor, AARP Utah, for making our virtual forums this fall possible, and we would like to thank our media sponsor, KCPW, for recording and rebroadcasting our forums as part of the Hinckley Radio Hour. Today's forum is the politics of COVID in Latin America. There will be an opportunity for questions and answers at the end of the presentations. If you have questions for our panelists, please enter them into the YouTube chat. With that, I would like to introduce Claudio Holzner, Associate Professor of Political Science and Director of the Center for Latin American Studies, who will introduce our panelists.
Thank you, Anne, and thanks to the Hinckley Institute of Politics for hosting this forum. As Anne said, I am the Director of the Center for Latin American Studies at the University of Utah. My name is Claudio Holzner. We have a fantastic panel of country experts today to talk about the politics of COVID, right? The responses that different countries have taken to the pandemic. We've lined up 4 panelists. I'll introduce them in order that they'll present. So first off is David DeMicheli, who is an assistant professor at the University of Utah. His research focuses on race and identity in Brazil, and he'll be talking to us about the Brazilian case today. Laura Gamboa, she's also an assistant professor of political science at the University of Utah. She researches the conditions under which democracies slide into authoritarianism and is a specialist among many other countries on Colombia, and she'll be discussing the Colombian case today. Caitlin Andrews Lee is an assistant professor in the Department of Politics and Public Administration at Ryerson University in Canada. She's joining us all the way from Canada, which is much easier to do over Zoom and YouTube than in person. Thank you for joining us. Her research and her book compares the populist and charismatic movements in Argentina and Venezuela. And she'll be discussing the Venezuelan case, which is a bit of an outlier when it comes to Latin America. And finally, I'll be discussing the Mexican case, which is the country that I specialize in. The way we'll proceed is I'll give some brief introductory remarks, and then we'll begin with the panel presentations. The panelists will take about 5 to 7 minutes to discuss sort of in broad sweeps the response to the COVID pandemic in their countries. Then we'll ask a few follow-up questions, try to get a conversation going between panelists. And then after that, we'll open up the conversation to the audience. We'll have Q&A, and as Anne said, you can post your questions on the YouTube chat, and we'll be forwarding those to the panel. So COVID is more in the news than ever. The case of the United States makes it clear that the handling of the coronavirus pandemic responds at least as much to political imperatives as it does to health imperatives. It's not always clear that our political leaders follow the advice of healthcare experts or epidemiologists, and instead the decisions that they make appear to be driven by political calculations and economic calculations. It's also clear, right, the elections that just happened in the United States make clear that how an administration handles the pandemic also has political consequences in terms of how elections are organized, who turns out to vote, and who wins? So this panel will explore some of these questions and issues in the case of Latin America. No part of the world has been as devastated by the pandemic as Latin America. Mexico, Brazil, Peru, Argentina, and Colombia, among other Latin American countries, are hobbled by weak healthcare systems, severe levels of poverty and inequality, and sometimes what appears to be government indifference. They've also been among the hardest hit by the pandemic, both in terms of the number of people infected, the number of people who have died from coronavirus, and also in terms of the economic consequences. To date, there have been more than 11 million confirmed infections across the region, and this is widely regarded as a serious underestimation of the actual cases, with approximately 400,000 deaths resulting from COVID-19, and those numbers are also considered to be a serious underestimation. The economic impacts have been catastrophic. The UN's Economic Commission for Latin America and the Caribbean estimates that region-wide, the economies will contract by 9% on average, erasing a full decade of economic growth. The projections estimate that this will be the most severe economic crisis that the region has faced in more than 100 years. The economic downturn is expected to exacerbate already high levels of poverty and inequality. The UN again estimates that the number of people living in poverty will increase by 45 million in 1 year to about 37% of the region's population, which is just a staggering number. In addition, Latin American countries face significant challenges in battling the pandemic. In many countries, healthcare institutions tend to be weak. Poverty and inequality are serious problems, and the disease, like in the United States, has tended to affect the poor more than it has other groups. Government safety nets tend to be really thin in most countries, in part because 40 to 50% of the population works in the informal economy, so they don't benefit from any kind of safety nets that might exist. So for many people, the choice, they don't really have a choice of quarantining if they become sick or exposed. They end up going to work regardless of their health condition. Responses to the pandemic and these challenges have varied significantly from country to country, and that's something that this panel will explore. We'll begin with the case of Brazil. So David, why don't you lead us off?
Sure. Thanks, Claudio, so much for the introduction. And thanks to everyone for joining us today. I'm excited to have a chance to talk about the Brazilian case and sort of the politics around the response. So let me just say first, Brazil, as the largest country in Latin America and one that was once seen as an emerging global powerhouse, it's received a lot of attention in the media, in particular around COVID. It has the most cases in the region, the most deaths in Latin America. Not necessarily the worst rates in these regards, given the size of its population. This situation fluctuates over time a little bit from month to month, but, Brazil does remain among it's seen as one of the worst performers in the response to the pandemic. There's so much to say about the virus itself and what parts of the country it's affecting the most, and which sectors of the population it's affecting the most. I'm going to try to, I can address some of those things in Q&A if folks have questions, but I'm going to try to be brief and focus more on the politics behind the COVID response, which of course, for anyone who isn't familiar with the case, centers around the current right-wing populist leader, Jair Bolsonaro, who was elected in 2018, kind of in the mold of Donald Trump, in this sort of kind of spiral of political chaos that was sort of unfolding in Brazil, and that had really discredited a lot of mainstream political parties in the country. A lot of what I'm going to say today is probably going to sound familiar to many of you because it is not all that different from what we've seen here in the United States, where we've been experiencing a response guided also by a right-wing populist leader. But one of the things I want to talk about in the Brazilian case is the distinction between the sort of public health response that we see to the pandemic and the economic response. In a lot of ways, the public health response, it's a lot of the same tricks that we see Trump use in the United States. But by contrast, I think what we've seen in Brazil is a much more consistent and aggressive economic response to the virus than we've seen in the United States. And so there's a sort of an interesting, a sort of a difference between those two prongs in the response to the crisis that we're seeing in Brazil relative to the United States. So, on the public health response, one of the main, things to understand, I think, in trying to understand the lack of response or the sort of the lack of political will behind responding really aggressively to the public health crisis is the extent to which leaders like Bolsonaro really hang their hat on economic performance. He took office in 2018 after years of economic recession in Brazil with really, really high levels of unemployment, and sort of returning the country to a period of economic growth or a period of economic prosperity was something that he promised, something that is largely outside of his control. And so the idea that something like a pandemic that would come along, shut down the economy and really worsen an economic crisis rather than turn it around is something that's really, really politically threatening to a leader like Bolsonaro. Again, this sounds a lot like what we've seen here in the United States. So it's not a coincidence, I think, that we see Bolsonaro employing similar tactics to the ones Trump uses, downplaying the severity of the crisis, the severity of the virus itself and its symptoms, the sort of mortality rates, pushing medicines like hydroxychloroquine and even taking them himself, attending protests and rallies without taking a mask, contracting the virus himself, and even very publicly clashing with his health ministers and advisors. At the start of the pandemic in the spring, Bolsonaro had a very, very public, very acrimonious relationship with his health minister at the time, who had a lot of confidence in the public and sort of putting forward a number of really critical steps to try to control the spread of the virus. And he was eventually fired and replaced with initially an individual who was not seen as particularly competent, and then by another individual who was at least less public in his criticisms, even though they continue to diverge, his public health advisors and Bolsonaro in the kinds of responses that we're seeing. So for those reasons, the virus has never really been kept in check on a national level. Brazil is a federal system, and so like in the United States, the response to the virus is really checkered across the country, and it's really left to state governments to sort of respond. Sao Paulo is one of the states that was hardest hit by the virus. Not surprising because it's the largest city and it's the sort of most international cosmopolitan city in Brazil. Outspoken governors like João Doria, who's the governor of Sao Paulo, who implemented really, really strict shutdown measures in Brazil, has clashed very, very publicly and very loudly with Bolsonaro. And it's led to a number of sort of political, it's just created a lack of a unified national response to the virus, one that's very state by state and checkered. And so we've seen states like Sao Paulo that have been able to keep the virus transmission rates down, but have not been able to, but this is not the sort of the trend that we see across the country. Other states, in particular ones that are politically aligned with Bolsonaro, have been slow to implement measures and have seen really high spikes in coronavirus transmission rates across the country. So on the whole, I would say the public health response to the crisis has been really uncoordinated, and Bolsonaro has taken a number of steps to sort of undermine this. But this is really different from the economic response that we've seen from the country, which has been national in nature, it's been unified, and it's been really quite assertive. Bolsonaro, but also the National Congress has passed a number of aid packages to, send financial and other resources to states and municipalities. They beefed up unemployment insurance, which, to formal sector workers, but they've also created a universal emergency income for informal workers. They increased enrollment in their Bolsa Familia conditional cash transfer program, which targets the poorest households, and sort of beefed up aid to small businesses and large businesses as well. It's worth noting that the universal income that they implemented as an emergency measure for this crisis is 600 reais per month, which is 3 times the current payment that families receive under the Bolsa Familia, right? So it's really a substantial amount of money that they've been investing in and sort of guaranteeing to the whole of the population. So One of the sort of paradoxes of this is that we've seen in Brazil. I'm going to try to wrap up here quickly. Is just that what we've generally seen from the public is a pretty high disapproval rating of Bolsonaro's handling of the crisis. The majority of the public, even the sectors of the public, the traditional middle class and the elite sectors, who are Bolsonaro's most vocal and enthusiastic supporters, even they disapprove of his handling of the pandemic. But this has not necessarily translated into disapproval of Bolsonaro's government in general, right? So whereas we see really, really low marks for Bolsonaro on the handling of the pandemic, he's actually seen, quite recently in September, public opinion firms have showed that he's actually hit his highest approval ratings of his entire government, a jump in his approval of about 10 percentage points to around 40% of the population, saying that they approve of his government. So there is this kind of paradox happening where even though individuals are rather disapproving of his handling of the pandemic, they don't necessarily disapprove of his government overall. And in particular, largely because of the kind of emergency aid packages he sent to the population overall, he's made the greatest inroads with lower class sectors, right? These are the sectors of the population that are the most likely to support the Workers' Party, the large center-left party that was his main opposition in the 2018 election. So essentially what we're seeing is that there's we see his traditional electoral support bases willing to criticize his response to the pandemic. They're not necessarily breaking from him in a broader political sense. What we're also seeing is that he's starting to make inroads with these sectors of the electorate that are traditionally relied upon by the center-left Workers' Party. So what exactly this sort of means moving forward for the political consequences for Bolsonaro are not exactly clear. But one question I'm sort of asking myself, or sort of something that seems sort of apparent, or at least suggestive already, is that the pandemic has not really served as a kind of political shock that could sort of unsettle the political cleavages that existed in the country before the pandemic. So I can elaborate on any of those points, but I will leave my comments there.
Thanks so much, David. So next up is Laura Gamboa, who will speak about the Colombian case.
Hi, everybody. Thank you for having me here. So for some reason, I thought I was going to present after Mexico, so a lot of my remarks will compare towards Mexico.
Sorry, we can switch it up. Sorry.
No, that's fine. You're good.
I messed up.
No, you're good. Okay, so I'm just going to say a lot of my remarks will probably reference Mexico, but I'm sure Claudio will tell you everything that I already told you afterwards. So Colombia, unlike Brazil and Mexico, was really quick in acknowledge the pandemic. And the response was fairly swift. I mean, fairly fast, even if not entirely without resistance, right? So what we see in Colombia is a closed airports fairly early in March. We see a nationwide shelter in place that went all the way from March to August. Schools went online. There's some kind of mask mandate, although it's mostly on public transportation, but for the most part, there's no debate about using masks. And so in this sense, Colombia sort of aligned itself more with countries like Argentina or Peru, who were seen as having sort of the right steps to deal with the pandemic. Of course, this shutdown had dire consequences, some of which Claudio already summarized in his introduction. Colombia has seen the highest unemployment level historically since the 1990s crisis. GDP growth has dropped roughly 15 points. And in response to this, the government sort of rolled out a package the extent to which this package was economic help or not is debated, but what experts would say is roughly is the equivalent to 6% of the GDP, of the country's GDP, which is, by the way, the lowest aid package in Latin America, but still is an economic package that includes credits for businesses, conditional cash transfers, or money towards conditional cash transfers, return for sales taxes to lower income brackets, and subsidies for employment. And so, of course, the question is, well, how has this worked? And economically, the economics of the economic response has been complicated for the conditions that we had seen in the past, right? So the economy was very weak to begin with. It had taken a hit due to lower prices of oil, high levels of inequality. It also got to Colombia at a time in which we had a fairly high fiscal deficit, which means now that we actually need money to inject into the economy, we don't have the ability to go into more debt. Very high number of informal workers. Roughly 7 out of 10 workers or people who are employed in Colombia are employed in the formal workers, which means these are people that do not have access to sort of the social network that you would usually have. The equivalent in the United States would be sort of unemployment insurance, and these kind of things are not available to informal workers, which of course has complicated the response. Like, how do you get money to these people, right? On the health front, Colombia has fared better than some of these countries, but not entirely good. So in terms of the number of cases, we're like within the top 10 countries in the world. Per capita, we're a little lower, but still, and sort of behind other countries like Panama, Peru, Argentina, Chile, Brazil, Costa Rica. In terms of deaths, especially deaths per capita, we're faring comparatively well with regards to other countries in Latin America. But in general, we have seen a total deaths of 32,000 people, which is quite significant, and 1.1 million total cases, which of course takes us to the interesting part of this panel, which is the leadership, right? And so I think the consequences of the pandemic are yet unclear, but what I see is 3 trends, and I'm going to talk about them separately. The first one is a conversation about leadership, which is something that has happened here in the United States as well. While Colombia as a whole was seen as having an appropriate response to the pandemic, internally things were a little bit more disputed, right? So like a little bit like it happened in Brazil, not as contested, but like it happened in Brazil, national leaders were very hesitant about implementing drastic measures to control the virus, whereas local officials were very much in favor of quarantines, shutdowns, and all of these very drastic measures. This has to do mostly with the fact that the consequences of health and transportation and the collapse of the health system will fall on local leaders, while the consequences of the economy will fall in national leaders, right? So the president just didn't want to take the blame for this, and vice versa. And so this has particularly manifested in a divide between the Bogota mayor, Claudia Lopez, and the president, Iván Duque. Now, this has aligned as well with a series of, with the problem of individual style, I would say. Duque, so Claudia Lopez has been seen as a leader that has most forcefully implemented the kind of taken the lead on how to respond to the pandemic. But this kind of contrasts with Duque, and this comes with 2 different types of leaders. Duque attained the presidency, became president with the support of one of the most popular politicians in Colombia, Álvaro Uribe, but without a base of support of his own. So before he was handpicked by Álvaro Uribe, thank you, Claudio. He became, before he was handpicked by Álvaro Uribe, Duque was fairly unknown. He has been in politics very shortly. Claudia Lopez, on the other hand, is a brand of her own, right? And so in general, what we have seen here is kind of a collapse of these 2 styles, which has translated, among other things, on moves by the administration to enhance their control and build legislative coalitions, taking advantage of the pandemic, in particular, the making Congress online, right? And so by taking Congress online, the government has reduced the spaces for debate, and this has created a lot of discontent amongst the opposition and amongst the people, which leads us to the last thing that I wanted to say, which is what we have seen in Colombia is a combination of previous discontent merging with this new discontent, and an outbreak or re-break, I should say, of protests. So on September, what we saw is a series of protests against police brutality. And this is a combination of previous discontent coming in with new discontent. And sort of the way the president has handled this protest comes in stark contrast with the way the mayor has handled this protest. and pretty much lines them up in the president being sort of the iron fist president, whilst the mayor more on the side of reforming the police type of mayor. I think that I'm out of time, but I'll be happy to answer more questions in the Q&A.
Thank you, Laura. Now I'll be able to reference the Colombian case in my remarks. So I'm going to be talking about the Mexico case. It's a case that perplexes me a little bit. Unlike, I suppose, the Brazilian case, the US case, and the Colombian case, where right-of-center presidents are in power and handling the pandemic, Mexico has a left-of-center president, a leftist populist, right? So there are similarities in the way that the president, Andrés Manuel López Obrador, affectionately called AMLO, I'll probably be calling him AMLO during the panel. There's I think there's some similarities in the way that the populists have handled the pandemic in terms of their discourse that they've used. But there are also some important differences with regards to the Mexico case. So first I want to set up the context for the Mexico case to give you a sense of what the political debates were before the pandemic struck. And then I'll talk more about the pandemic and its response. So López Obrador came to power in 2008 in an election which he won by wide margins. He was the first president since Mexico became democratic in 2000 to win an outright majority of the popular vote. He's also the first president to win majorities, or his coalition won majorities in both the Mexican House and the Mexican Senate. This made him a president with a huge mandate, a powerful mandate, and also with the political support to carry out the mandate in ways that previous presidents had not. And then the other significant aspect of his election is that he is the first leftist politician to win power in Mexico since the transition to democracy, in a country that has a long history of leftist political mobilization, a country where, depends on the year, 40 to 50% of the population lives in poverty. It's always been a little perplexing why leftist parties and leftist political leaders have not had more traction. So he came to power with a mandate, and he was also enormously popular. The first year of his presidency, he enjoyed sort of approval ratings in the range of 80%. He was the envy, if you will, of Latin American presidents. He had, like Donald Trump, he has a core base of supporters who are unfailingly loyal. He also came to power in the context of the collapse of the party system. That might some of my colleagues might consider that an exaggeration, but there's definitely a realignment happening in Mexican party politics, and the opposition parties now on the right are not terribly well organized and don't have a terribly good message to contrast to López Obrador's message. So then in 2020, the coronavirus hit. I'm going to share my screen and just show you the numbers real quick. These are numbers. Can people see the screen in the Zoom call? Great. So on the right, you'll see this is the New York Times data. What you can see in Mexico, that there was a sustained rise in the number of cases that was more prolonged than most other countries. From the beginning of the pandemic all the way through the later part of the summer, the numbers were just increasing steadily. Now they seem to have plateaued. If you will, the curve has finally been bent, but it's been bent at this very high base level. The numbers aren't really going down. What's troubling, so one of the weird things about this case is that I'm not exactly sure why the numbers have started to go down. I'll talk a little bit about the response in a second, but a couple of things to note about these numbers is nobody trusts them, right? They're considered to be widely under reporting both cases and deaths. Recently, the Mexican government admitted that 193,000 excess mortality cases during this period, contrasting with the 95,000 official deaths. So we think that the number of deaths are probably in the 150,000 range in Mexico by now. If that were the case, that's at least a 10%, if not a 15% mortality rate, which is the highest in Latin America. The infection rate, if you look at these statistics, seems manageable, right? It's at a high rate, but it's not spiking like it is in Europe or in the United States. Across Mexico, the infection rate is 4 to 5 per 100,000. In Mexico City, which is the hardest hit city, it's 12 per 100,000. That compares to 37 per 100,000 in the US and 70 per 100,000 in the US. But again, like, we don't know what these numbers mean because the testing rate is really low. Mexico only tests about 10 out of every 100,000 people. Only people who show up at hospitals get tested. And the reports that I hear from friends and family is that even if you get tested, you'll never get a result, right? You'll spend your entire quarantine not knowing whether you had it or not. And the positivity rate has been stratospheric. The World Health Organization would like to see positivity rates below 5%. In Mexico over the summer, the positivity rates were 50%. That means for every person who was tested, half came back positive, right? And so what that, I'm not an epidemiologist, but what I think that tells us is that the Mexican government is flying blind. There are just hundreds of thousands of coronavirus cases out there that nobody knows where they are, and they're just continue to spread. So there's some doubts about whether Mexico has actually bent the curve. In terms of response, it's been very similar to what David and Laura have described, a populist president who has downplayed at least initially, the severity of the pandemic, favoring instead keeping the economy open, as opposed to finding ways to limit the spread. Mexico is also a large federal state. And so the responsibility for dealing with the outbreaks has fallen on state and local governments. In Mexico, state and local governments tend to be relatively weak the institutions are relatively weak compared to the institutional capacity at the national level. And so the ability of state and federal governments to deal with the outbreak has varied a lot. So I'm going to show you another chart and just sort of remember that the official mortality rate in Mexico is about 10%. I think that's the third highest in the world, by the way. This chart shows the mortality rate across Mexican states. And you can see that it varies from about 5% in Baja California del Sur to well over 15%, approaching 18% in Morelos, Baja California, Sinaloa. So the impact, right? So the ability of this sort of suggests that the ability of healthcare institutions in different states is really varied, right? So it matters where you live for the care that you get in Mexico. I'm gonna try to stop sharing my screen. So the response has been, so in contrast to Colombia and Brazil, there has been no economic stimulus package, which is unusual for a leftist populist president who generally are not shy about incurring debt in order to stimulate the economy. I'll disagree a little bit with Laura here. Mexico has had the smallest stimulus package in the region at 1%, right? So 1% of GDP. And most of it has been in the form of cash transfers, not exactly living wage, but just cash transfers to informal workers, informal merchants. They've been very small, sometimes in the form of loans, $1,000 loans, but not really enough to make a difference. He has absolutely refused to bail out any companies, whether large or small, in Mexico. And so there's a significant worry that the economic recession that Mexico is currently experiencing will be severe and long lasting. Mexico is running out of money. It has the ability to borrow, but the president is taking resources from a variety of different pots that he has access to, including state governments, and trying to concentrate them as an example, he just eliminated all government trusts, sort of funds that are designated for specific expenditures. He eliminated 109 of these trust funds in order to be able to purchase vaccines when it's available, right? So it suggests that the government is really facing a fiscal crisis in addition to the economic crisis. And so folks are really worried that this recession will last for several years, much longer than in other countries. And for a leftist president who ran on a platform of reducing significantly poverty in his country, in Mexico, he might end up with poverty rates much, much higher than when he entered office. And I'll end with this. His popularity rate has dropped from 80% to about 50%. And he's facing midterm elections next year. But much like Trump and I suppose Bolsonaro, it's not dropping much farther than that. There seems to be a floor to his popularity. And so it's not entirely clear what impact his handling or mishandling of the coronavirus will have on his popularity and sort of on future elections in Mexico. And so with that, I will stop, and I'm glad also to take questions in Q&A. And I'll hand it over to Caitlin, who will talk about the Venezuela case.
Hello, everyone. Thank you so much, Claudio and the Hinckley Institute for having me be part of this conversation today. I will be talking about the case of Venezuela. And as Claudio mentioned in the introduction, it really is quite a bit of an outlier in Latin America for reasons that I'll explain. And first, I'm going to show my screen. Can you all see that on Zoom? Okay. So first, I just wanted to give a brief overview of what COVID looks like in Venezuela. Like Mexico and most countries in the world, it's actually a controversial and uncertain question what it looks like, but I'm going to show you what it at least looks like on paper as reported by the Venezuelan government, and then talk about some reasons why we might be suspicious of those numbers, and then get into the reasons why we might be suspect and some of the unique challenges that Venezuela's had in addressing the pandemic. So as you can see with this curve here and the number of positive COVID tests to date or active cases in Venezuela, it's actually quite low compared to other countries in the region. You have just shy of about 94,000 positive cases as of last week confirmed by the government. And then a shockingly small number of deaths, about 814 total, for a case fatality ratio of less than 1%. If you look at some numbers, comparing Venezuela to some of the more advanced industrialized countries in the world, as well as some of the more similar surrounding countries, these numbers look pretty stark. So Venezuela, at least by some measures, is performing better than countries with very well-established healthcare systems and much more developed societies, such as Switzerland and Canada, especially with the number of deaths, as you see. And then countries that have a lot more in common and are geographically proximate to Venezuela, including Colombia, as Laura mentioned, and Peru, have upwards of 1 million cases and much higher case fatality ratios than Venezuela. So this is very curious. Why would we see so many fewer cases in Venezuela than, for example, in Colombia and Peru? There's actually one reason for this might be that similar to the rest of Latin America, COVID came later than it did to some more advanced areas where there's a lot of international travel. Venezuela in particular is a regional and global pariah. There's not a lot of people coming in and out of Venezuela. So a lot of people think that so this could be one reason why COVID took longer to get there. In addition to that, similar to Colombia, perhaps surprisingly, the government led by the authoritarian leader Nicolás Maduro had a fairly proactive and very early comprehensive response to COVID, again, at least on paper. So they had testing capacity. So Venezuela has a unique relationship with China and was able to access a much larger number of tests from the early period than some neighboring countries. So they got, to date, they have supposedly over 2 million tests available. Most of these are rapid tests, which have a high false negative rate and are not considered to be as comprehensive and thorough as the polymerase chain reaction tests, which test for the actual viral DNA and take longer to process. But nonetheless, it's better than nothing, and it's actually a lot more than some other countries, including the United States, have been able to achieve. In addition to this, they actually had a pretty systematic system, at least from the beginning, for trying to detect COVID. So there's a computerized system called the Fatherland system in Venezuela that is responsible for distributing benefits, social benefits to the population. Venezuela is in a devastating economic crisis and humanitarian emergency, which I'll explain in just a moment. But consequently, 96% of the population relies on social benefits from the government, which requires filling out this survey. So what they did from the beginning was required people, in order to receive their benefits, to fill out a survey with their COVID-19 symptoms. Those who had symptoms were visited by a healthcare official in their home and administered a rapid test. And those with positive rapid tests were then given a follow-up PCR test, that more thorough test. So while this is certainly not a perfect system, it's a lot more systematic than most countries had in addressing the virus. Now, in addition to this, the government had policies, a mandatory mask mandate, a mandatory quarantine, which was flexibilized over the summer, but nonetheless still in place. And then they followed the Chinese model, which is pretty unique in the world, of having forced isolation of infected individuals in these centers, these quarantine centers called PASI, or Puntos de Atención Social Integral, which are makeshift hotels and auditoriums and other places where supposedly citizens who are infected, or people who are infected with COVID-19, can serve out their 14 days, receive healthcare, be socially isolated, and then return to the population. Now, COVID-19 in practice, I would argue, looks quite a bit different, and we have a lot of reason to believe that these numbers, especially not only positivity rate, but the number of deaths in Venezuela due to COVID-19, are much higher than are being reported. First of all, just to go back really quick, there are serious issues with the testing capacity. While there's a lot of rapid tests, first of all, there's an extreme lack of transparency with the government. So it's difficult to know if you can believe what the government has to say. Some colleagues have done searches of alternative measures of how prevalent COVID is in Venezuela, but nevertheless, it's very difficult taking the government's word for it. In addition, up until June, there was only one lab in the entire country for processing PCR tests. Now, supposedly there are 4, and there are reports that anywhere between 500 and 2,000 tests get processed every day, which is really a very, very low number. And so, like in Mexico, a lot of people who manage to get tested don't ever hear the results back, or it takes a very, very long time. In addition to that, I would argue that understanding the gravity and the potential threat moving forward that COVID has in Venezuela is impossible to understand without understanding the complex humanitarian emergency that Venezuela was facing before COVID-19 even hit. So in a household survey conducted by a collection of local universities, with a nationally representative sample that was cut short just before COVID hit, reported that in Venezuela, there's been a 79% fall in GDP since 2013 when Maduro took power. That's a bigger economic drop than any country in the history of Latin America. So that is a devastating economic situation. 96% of people are in poverty. 97% of households struggle with food scarcity, and over 5 million people have emigrated since 2015. Many of them are younger, they're the professionals, a lot of them are doctors and healthcare workers. In addition to this, you add things that Laura mentioned. Colombia is also struggling with the low price of oil, and then uniquely in Venezuela, extreme declines in production of oil, which is up until recently was the primary and virtually only source of revenue for Venezuela. And then punishing US sanctions in an effort to kind of take a hardline policy to oust Maduro has made this, this crisis even worse. So you take that situation, which is just devastating at a whole different level than most of the neighboring countries are experiencing. And you add to that COVID-19, and you have the potential for what human rights organizations and the UN have called a tsunami of disaster. So you have basic supplies for life and health unavailable to citizens, unavailable to healthcare workers. Supposedly more doctors died. There's like I forget exactly the percentage. It's like up to 50% of doctors and healthcare workers who have been tested and are positive COVID-19 have died. Again, a lot of them are senior because most healthcare workers who are younger have emigrated. And the government is unable to provide the economic incentives to actually get people to quarantine. In addition to this, there's no healthcare infrastructure remaining in Venezuela. So we can talk about counting how many ICU beds the country has, but there's not even electricity and running water to make ICU beds and ventilators work. So what this looks like in reality is it's much, much graver than the numbers would suggest. So as you can see, a couple of headlines from recent months in Venezuela. The response to COVID is militarized. I realize I'm really over time. I'm going to stop in just a second. The mandatory quarantine centers are actually highly variable in quality, and a lot of them have squalid conditions. People are not socially distanced. They can't even access food and water. And in addition to that, you have a lot of people who emigrated from Venezuela who lack the social safety net in their other countries and have lost their jobs and are being forced to return. A lot of them are bringing COVID back with them. And the government response to that has been just terrible. They're being labeled bioterrorists. They're being detained in these centers. They are required to have 3 negative rapid tests before they're released, and they often never even hear results. So some people are being detained for weeks or even months. I will get into the politics of why this is in the Q&A, but basically my central argument is that the underlying economic crisis is what is making COVID-19 such a grave threat in Venezuela. And the reason is that Chavez, the charismatic populist that preceded Nicolás Maduro, had these terribly unsustainable policies combined with extreme popularity that made them very difficult for his handpicked kind of loyal successor to reform. He became increasingly authoritarian because he lacked a mandate of his own, and yet he's been unable to actually reform policies to address the crisis. And so that's part of why we have the situation we do today. So I'll stop sharing my screen, and I look forward to the discussion.
Thank you, Caitlin. Thanks, David and Laura as well. We have a number of audience questions, so I don't want to take too much time, but I want to ask a couple of follow-up questions of the panel and then move quickly to the audience questions. So I'm struck by, so in the United States, the pandemic coincided with a lot of protests that may or may not have been directly related to COVID, but there seems to be a sense that there was this unsettling, right, of the social fabric that maybe contributed to more protests, in addition to discontent with the way the Trump administration handled the virus. I'm curious, I guess, in particular about Venezuela, because it's an authoritarian regime, but also about other countries, whether you've seen the same kind of street politics, protests, whether directly or indirectly related to the COVID response, challenging the legitimacy of the leaders in power?
Thank you. That's a great question. I think this has been one of the most devastating political consequences of COVID in the country, is that people were afraid before Maduro was becoming increasingly authoritarian, but we saw a lot of pretty vibrant protests up until COVID hit in March of this year. What we've seen now is an extreme drop in street protests. There's a lot of there's a huge authoritarian crackdown because the quarantine, while technically mandatory, is fluid. It's actually militarized. So you see military beating people in the streets, making children do push-ups for violating mask mandates. And obviously those things are politically targeted rather than actually for violating quarantine. There's technically legislative elections coming up this year and next month, and polls suggest that a mere 16% of people are intending to participate. So the last National Assembly elections in 2015 were really pretty vibrant and the opposition actually won. So we've seen increasing declines as the government has become more authoritarian, but COVID-19 has really clamped a lid on political participation and protest.
So, completely different circumstances, but like many other countries in Latin America, 2019 was a year of protests in Colombia, right? So in November, we saw the largest set of protests the country has seen in a long, long time. And these were the outcome of government policies trying to undermine the peace process in connection with a government that it was fairly weak because, again, Iván Duque does not have support of his own. His support depends on Álvaro Uribe, and Álvaro Uribe has policies that are hard to implement. And then you have a spike in the assassination of grassroots leaders, and then COVID kind of threw a bucket of water on those protests, right? Like it just quieted them down, pretty much like it happened in Venezuela. And then what ended up happening, however, is that eventually with time, the government there's the shelter in place, and you have a lot of informal workers that honestly cannot eat unless they work. That's just the basic situation. And you start seeing like the situation pile up. And then a couple of months ago, 2 months ago, there was a very visible case of police brutality against a person of color. And very much like it happened in the United States, the video of YouTube became viral. People went out again on the streets. This is again a combination of all of these things kind of simmering in. The response of the government has been mostly iron fist. The government sided with the police. They touted the theory of the bad apple is just one bad police officer, whereas the mayor has been siding with the protesters and kind of calling for police reform. Right now, it is unclear because the government is standing still. The Supreme Court ordered the government to apologize for the case of police brutality. The government refused for a long, long time. So it's kind of a stalemate right now, and very much dampened by the fact that protesting while COVID is just incredibly hard.
So in the Brazilian case, there have been a fair number of protests in 2020. Most of them, there's some that are related to COVID and some protesting of the lockdowns and quarantines, some of the state and local measures that have been put in place. But mostly they've been kind of pro-Bolsonaro protests, and in particular kind of rallying around, some very high profile protests that took place in the Capitol when he was attacking the Supreme Court and the Congress for not sort of complying or cooperating with his agenda. And so, we saw a number of protests break out in the capital city that were pretty large and got a lot of media attention. But one thing that's different from between Brazil and the United States is that there is this kind of main political cleavage that is kind of around the Workers' Party that has kind of, sort of pro or anti-workers party that has emerged in Brazil. But one difference is that, while Brazilian society is kind of polarized, it isn't very partisan. And so a lot of these things don't necessarily map onto necessarily shape or, affect all of the way that individuals sort of interpret these kinds of crises. So whereas, the Black Lives Matter protests in the United States really mapped onto the kind of the party system and the partisan cleavages that we have in the US, that's less clear in Brazil. There were these protests that were pro-Bolsonaro, they were his sort of avid supporters. But what we're not seeing, for example, is this kind of partisan divide or even political divide in how individuals interpret COVID data, understand the severity of the crisis, and approve or disapprove of Bolsonaro. And in fact, it's Bolsonaro's electoral constituencies, the middle and upper classes, who are the most likely to disapprove of his performance, his handling of the coronavirus crisis. Now, like I said earlier, that doesn't translate into a lack of electoral or broader political support. But what we're seeing is not the same kind of deep, partisan divide or, profound political divide that sort of, engulfs all of the way that folks make sense of the crisis in Brazil. So there have been some unrest, but I would say in general, it's more of an expression of the kind of Bolsonaro's political base than it is kind of compounding the sort of a compounding effect of these multiple crises the country's going through.
Thank you. I'm going to actually switch to audience questions to make sure we get a few in before the 1 p.m. mark. There's a few which I'll lump together about Mexico. So one is, are we seeing any COVID spikes brought on by American tourists coming to Mexico? Are the statistics from Mexico also accurate for smaller areas, states, rural areas, pueblos? And a third one is, what are some of the reasons why AMLO might not be pursuing a fiscal stimulus package like his colleagues? And so I'll take these first. And so I think the underreporting of cases in urban areas like Mexico City, where people suspect that there are 3 times as many cases as reported and 3 times as many deaths as reported, probably is magnified in rural areas and small towns. If you're only getting tested at a hospital, if you don't have access to hospital or clinic or healthcare facility, you're not getting tested. And so I think the basic policy is one of, if you have symptoms, quarantine, and but we just don't have the testing capacity to test. So that's another reason that I suspect the numbers are much, much higher than officially reported. Spikes have coincided with, like in the United States, with national holidays and with tourists. There's a lot fewer tourists from the US going to Mexico. It's been one of the sources of the economic crisis, a severe reduction in the foreign revenue coming from tourism. But anytime there's a long weekend, people leave their towns, leave their houses, go to a different region, go to beach resorts, and then there's inevitably new spikes, new coronavirus spikes. And then potential reasons for why AMLO hasn't pursued an economic stimulus package is he seems to be a fiscal conservative. He cut his teeth in Mexican politics during a period of repeated and severe economic crises brought on by indebtedness and the inability of the Mexican government to pay back its debt to foreign creditors. Maybe as a kind of an attempt to maintain autonomy, sovereignty, he's unwilling to take on significant foreign debt. And so as a result, he's being very frugal in his response to the economic crisis. Certainly there's a political element to this in that he does not get along with private businesses, especially large multinationals. And they've lobbied hard for an economic stimulus package from the federal government, and he's flat out refused. The quote is something like, "You guys do what you need to do, and I'll do what I need to do." And that's as far as he's willing to negotiate. And so whatever funds he has available, he's dedicating to individuals and small businesses, not to large corporations. So I guess those are my answers. So he's a fiscally conservative populist, and I'm not sure that those things often go together. I have a question for Venezuela, for Caitlin. how significant have the US sanctions been on Venezuela's effort to contain COVID, given that they're pretty extensive?
Thank you. It's a really important point. In particular, the U.S. sanctions on Venezuela have played a major role, I would argue, in their and many argue that in particular, what the sanctions have done, what they've intended to do and have failed to do so far, is to get Maduro to step down from power. And those are the stakes. Either he steps down from power or there's no negotiation, no conversation to be had. That's the current US policy stance, and what's driving that's the conditions underlying the sanctions. What that's actually achieved is it's cut off the Venezuelan people to a lot of aid and economic opportunity. It's made it very difficult to get supplies and humanitarian aid into Venezuela. And at the same time, it's driven Maduro, it's increased the stakes of power. So it makes it much less likely, ironically, that Maduro steps down because his situation is increasingly desperate. So the regime in Venezuela is kind of facing this bizarre situation where the economy and the humanitarian crisis are exploding, and the sanctions have very much exacerbated that. And at the same time, Maduro is hardening his and further securing his grip on power. And just as an example, a couple of weeks ago, there was an exemption to the US sanctions allowing diesel for oil swaps, which allowed the import of diesel into Venezuela. And that was just ended. And so with every additional sanction and policy like that, it's cutting off the Venezuelan people while doing from aid and addressing the crisis as well as the pandemic. And it's not really having its intended effect politically.
Thank you. I have a question about Bolivia, and I won't answer it, so I invite the panelists to answer if you dare. What's been the impact? I mean, Bolivia, what I do know is that in Bolivia, presidential elections were postponed once or twice because of the pandemic. What has been the response in Bolivia, and what do we anticipate? Do we anticipate the response changing after the elections? I'm not going to answer it. So
okay, I'll be the brave one here. So I am no expert in Bolivia. Having said that, the COVID caught Bolivia in a very particular electoral crisis. They in October, they had these very much contested presidential elections that resulted in the oust of Evo Morales and his, let's just say, irregular replacement by Áñez, who is a right-wing leader in Bolivia. Áñez had, initially, before the pandemic hit, Mas and Áñez and sort of the right wing, the very far right wing coalition in Bolivia had struck an agreement to have elections. I believe it was in March, and then the pandemic hit, and they just closed down everything, right? And because of Áñez's behavior, because of the way Evo Morales was removed from power, and because Áñez had taken advantage of her position in power to repress and to use violence and a series of very non-democratic behaviors. There was a lot of contention about the suspension of the elections, and there was a lot of criticism. Now that the elections have happened, now that Mas won, I am not sure that there's going to be so much of a politicization of the pandemic. And I might be wrong, and so the panelists are free to contradict me, but it seems to me that the pandemic and the measures against the pandemic were only politicized in the context of when and how were the new elections going to be held. it seems to me that now that we have that somewhat of the way, and that, like, it's clear that Mas won the election, there's a possibility that this won't be politicized as much. Having said that, of course, Mas is a left-wing government that has leveraged huge economic growth, and of course, shelter in place and all of these things will just harm the economy. And so I am not sure to what extent they will be willing to do these things that will potentially hurt their base and their support and sort of their political opportunities. That would be my take.
I am also not an expert on Bolivia, but I would also add to this that there does, from what I've read of the response in Bolivia, there does also seem to be a sort of an element of corruption happening, where a lot of their efforts to implement certain measures were, really stymied by well, at least allegations of corrupt bargains between officials and health advisors in purchasing, faulty health equipment and things of that nature. And so this has sort of opened the door to a host of scandals and kind of involving courts and, a lot of arrests of consultants and also judges who were involved in various decisions. And so the Bolivian situation is, I can't say too much in depth on it, but it does seem complicated, to say the least. And so in addition to all these questions about the election and sort of whether or not the president is abusing power, there's also these questions of, these other questions about whether or not the kind of advisors or the sort of the experts that one relies on are themselves abusing powers too, which have really created just, I think it seems, a terrible situation in the country, unfortunately.
So that answer leads me to another question from the audience. There might be a couple of them that are related. One of them is, do you think that COVID-19 has given leaders in Latin America an excuse to not abide by democratic standards or constitutional duties? And this might be relative to their countries. For Venezuela, will COVID continue to act as a silencer for political unrest? I think you addressed that a little bit, but also perhaps in other countries, whether there's any attempts to crack down, for example, on protests, speech, things like that. I'll start with a thought on Mexico. And so this is controversial and it's a bit of a counterfactual, so take it with a grain of salt, but there's been concern that because López Obrador won such a strong mandate, and because he is a populist leftist leader, that he might govern in the style of Hugo Chavez of Venezuela and Evo Morales in Bolivia, and leverage that popularity to stay in power. And so he's been sort of putting some pieces in place, for example, to potentially amend the Mexican Constitution to allow for presidential reelection. Currently, presidents can only serve one term. And that's a classic move by leaders who want to stay in power beyond their mandate, is to change the rules of the game to allow for their reelection, which, if they're popular, is almost sort of a guarantee. For those fearing that Mexico might go down the path of Venezuela or Bolivia, this lack of sort of this reduced popularity of López Obrador gives him less leverage. And in what's going to be determinative is the midterm elections and whether or not he's able to hold on to a majority in the House or the Senate. If he isn't, then that really ties his hands, and I guess checks and balances will be working in Mexico. But if he manages to make a political comeback and secures a renewed or stronger majority, then I think some people might be worried about what he would do.
No, go ahead, Caitlin.
Sorry, David. I'll be fast. Regarding, so I do think that COVID-19, as I mentioned before, has silenced a lot of the political unrest in Venezuela. In addition to that, I think another perspective that I just touched on at the end of my portion of the talk is that Looking at the legacy of Chavez in Venezuela is also important, and especially relative to the status and popularity of other politicians. So because Chavez is the only politician in Venezuela that has an approval rating still in death that is well over 50%. Every other politician in Venezuela, from Maduro to Guaido, the leader of the opposition and the recognized kind of president by most by most other countries, is dismal. It's like below 20%. And so there's this profound political disaffection, or kind of ambivalence and disappointment among Chavistas and the opposition in Venezuela. And it's also important to remember that one element of populism that is still very much in play in Venezuela is this extreme polarization and this narrative that Chavez had initiated, where that generates profound distrust of external actors, of the United States and other countries, of the United Nations and a lot of entities providing with the opportunity to provide humanitarian aid, as well as domestic opposition politicians. And so while people, certainly Maduro's approval numbers are low, they're not the lowest. And a lot of people continue to support Maduro for lack of a better option, or in the name of supporting the person that Chavez chose. So I think and moreover, the opposition has really mishandled the opportunities over the past several years, as Laura talks about in her work, and then also during COVID, to really try to regain that trust. And there's all the kinds of conflicts because of the dual heads of state situation between Maduro and Guaido, where Maduro is the de facto leader, Guaido, for a lot of entities, is the de jure leader. They have to come to an agreement in order to access a lot of the humanitarian aid that is technically available to Venezuela, much less to have it come in and be dispersed. And they're not anywhere close to working terms for the most part. There's some initial agreements between them that have started, and so we're seeing some glimmers of hope. But I think on the whole, people have no interest in turning out to support an opposition leader to oust Maduro in Venezuela. So in addition to the violent crackdown, there's that attitudinal piece that I think is really important and pretty depressing.
I would say in the Brazilian case, Bolsonaro does not need a pandemic to violate norms or democracy, right? Like, this is kind of very on brand for a populist, right? This idea that they are, right, their mandate comes from the people, and that, it's about the vertical accountability, not the horizontal accountability. And so, in that sense, I would say the pandemic has not itself really provided a unique opportunity for Bolsonaro. And in fact, I think it has created some opportunity for him to actually get some pushback. From the perspective of the state, there have been, in particular with the courts, they have shown a willingness to kind of crack down on some of Bolsonaro's tactics, and in particular, his desire to want to mobilize and incite some protests in the capital city. Around May and June, when he was inciting these protests against the court, he was sort of show up to these protests without a mask in defiance of local orders by the mayor, the mayor of Brasilia. The court actually ruled that, his argument, of course, being that he's the president, and so he doesn't have to abide by these local ordinances. But the court actually ruled that that's not the case, right, and actually imposed fines on him, right? So Bolsonaro himself has been fined by local governments for flouting these orders, right? And so you do see some, right, and then you do see these protests that became somewhat violent, and by some are called terrorist protests, by some in Brazil, that were organized against the court and against the Congress. Many of those leaders were sort of arrested. There was a sort of a crackdown on the organizers of those protests. And so you do see some pushback from the state against some of these more extreme tactics that Bolsonaro has taken during the pandemic. From the perspective of the voters too, the midterm elections are also imminent in Brazil. And so, one question that is sort of emerging is whether or not, sort of what effects Bolsonaro will have on the election without himself being on the ballot, not unlike, the midterms we saw here in 2018. And there are a lot of eyes on the local elections in Sao Paulo, which is, this traditional conservative state, but also city. And for a while, there was this kind of populist outsider candidate, Husumano, running for the mayor of Sao Paulo that was doing quite well. And in recent weeks, his numbers have sort of dropped significantly. And then this more traditional candidate, Bruno Covas, who's the current mayor, who took over after the previous mayor ran for governor, he sort of has started to rise in the polls. And where we saw candidates sort of approximating Bolsonaro and try to emphasizing their closeness to him as a kind of an electoral, a boon. In more recent weeks, we've seen them a little bit more of distance being put between them and Bolsonaro. So it'll be curious to see what happens locally in this really conservative state, this really conservative city, whether or not those same voters that sort of propelled Bolsonaro to the presidency are going to opt for this more traditional conservative candidate or a more outsider conservative candidate. So I think a lot of people are looking at these elections coming up to see, to what extent did Bolsonaro's actions during this pandemic actually affect his sort of political support, the kind of political support he needs among these kind of really conservative sectors in the electorate.
So can I jump in? So I wanted to make a small comment about Colombia. I think in Colombia, the president has in fact used a pandemic in order to sort of to hinder debate, most importantly, right? So and this is particularly specific to Congress, because of the way Congress is organized, and in particular because of the powers of legislative review that the Constitutional Court has, and sort of the powers the opposition has to bring members of the cabinet for questioning. The opposition usually had the ability to have some resistance to government majorities in Congress, and with varied levels of success. The fact that now Congress is virtual has changed those dynamics upside down, and the opposition has lost the ability to wield this power. And this is very interesting, mostly because they're not in the building and they can be muted from a computer. And so that has changed sort of the internal dynamics of Congress and sort of taken away some of the tools the opposition used to have to fight back. Now, more broadly about Latin America, I also wanted to bring into this conversation countries that, I mean, none of us are experts on, but I think are important. And one that I have in mind is El Salvador. So I think the pandemic has played a crucial role in enhancing Nayib Bukele's ability to enhance his powers and take over most democratic institutions in El Salvador. Not to talk about sort of implementing incredibly repressive measures in prisons and these kind of places. I also think this is true in Nicaragua, where also the ability to repress has been enhanced. And so I think, so to answer the question, I think if the fact that that COVID hit does not mean that every single president is going to try to enhance their powers. It does mean that those that wanted to enhance their powers and stay in office are going to try to do so, are going to try to use the pandemic to the extent that they can to do so.
Thanks. Those answers get at a couple of questions from the audience, including, so there's other examples of whether other countries in Latin America are leaning more authoritarian as a result of or whether leaders are taking advantage of COVID as a crisis moment to take more power. I find it interesting just listening. I kind of knew this, but there are other political consequences of COVID that don't get talked about, but maybe have political implications. For example, taking your legislature online, right? That may be worth a study. Because not some countries have, I think Argentina has, Mexico has not, for example. And so that changes, the United States has not. And so that changes the dynamic of checks and balances, for example, as you noted, Laura. So I think there's a lot of sort of interesting things that have yet to kind of emerge from the noise and the many different consequences. I have a kind of a hard question from the audience. Can any of you point to a country that has done a particularly good job in its coronavirus response?
Yes, no surprises here, but Uruguay has done a great job, right? I mean, I was looking at a chart over the weekend, getting ready for this, and it showed, Uruguay has some of the lowest, COVID rates in the region, which is, for those of us familiar with regions, it really is no surprise. But I think one of the things that really set them apart, it's a much smaller country, right, than most of the ones that we're talking about. And so in that sense, they have an advantage, but it's, they locked down strictly and they locked down early and they made testing really widely available. So they had a really aggressive public health response really early on. Another country that's really low in the statistics is Cuba, which, for all the reasons Caitlin mentioned, we might be suspicious of their data. But, I would say that, Cuba is also an advantage in that it's a small country. It's also an island, right? So it's one that is harder to get to, right? The borders are more porous than in other countries. And they have a really renowned healthcare system, right? So they actually have a number of things working in their favor that might, lead us to, we should at least recognize that it's, Cuba perhaps is well equipped to handle the crisis.
I have to add to that despite my going on about how devastating COVID-19 has the potential to become in Venezuela, that somewhat counterintuitively, and I think similar to Cuba, it's had a more centralized and systematic response, which I do think is at least in part true and has contributed to the containment of cases up until recently. So for example, if you look at the measures, the estimates of death, the government says there have been 814. The doctor working with the opposition says that's crazy. There are actually 1,600 deaths, but really 1,600 deaths, while being twice as much as that, the reported number of deaths is way lower than other, than the case fatality ratio in other countries and the total number of deaths. So I think that Maduro, is well aware of his tremendous failures with economic policy over the last 6 years, last 7 years. And COVID-19 gave him kind of dual opportunities. One, to have some semblance of competent performance, which to some extent, I do think that he has achieved, taking advantage of other factors such as Venezuela's isolated status before returnees started kind of flocking back to Venezuela. And the ability to kind of crack down and continue and escalate his authoritarian measures. So some similarities with Cuba, but also with the caveat that it has the potential to expand into a disaster.
I'm going to jump in on Caitlin's comment. I will point out that both Cuba and Venezuela are authoritarian regimes. And so certain things are just easier to do by sheer force. I wanted to say also that I think there's a distinction on doing everything so I think countries like Colombia, Peru are countries that have technically done everything right. It just has not been successful. And I think the question is, why hasn't it, right? And so there's various answers that we could ponder about, but in terms of health care response, or at least sort of in terms of the policies undertaken to control the virus, my sense is that countries like Colombia and Peru, Uruguay, although Uruguay has fared a lot better, have actually implemented what health officials would suggest you do, have done what they suggest you do. It hasn't been successful. And a good question would be why.
And I just want to jump in. I mean, Europe was considered a continent, right, with many countries that successfully battled the first wave of coronavirus and reduced numbers significantly. And this second wave is seeing cases much larger than during the spring wave, right? Also countries that did the right thing and were successful for a while and now are facing a very difficult situation. And so this question of success, I think, is not one we'll be able to determine now, right? We'll have to see how it plays out over the next few months. I think you all have pointed to this. I mean, there's going to be papers written about this, I hope, and maybe books. But this issue of centralized national response, right, is what's maybe is shared by Cuba, Venezuela, and Uruguay, compared to Mexico, Brazil, Colombia, and I would throw in the United States here, in that there's a combination of strength of institutions with the ability to coordinate a national response. And so I'm not sure whether Uruguay has a federal system or not, but I suspect it's more unitary than Mexico or Brazil. And so what's happening in Mexico is you might be successful in mitigating the spread of the virus in one state, but then it cycles to another one. I mean, that becomes a new focal point for the spread. And then you sort of, basically you're just, putting out fires, and the virus cycles through or circles through the entire country, much like what's happening in the United States. And that suggests the need for a national response, which some countries are better able to do than others. And I think what this panel has suggested is some political leaders are more willing to do than others. AMLO in Mexico has not been willing, Trump in the United States has not been willing to have a national response to the virus, preferring instead a national response to economic stimulus, right? And again, Mexico is different in this case. I have maybe to wrap up, a final question that maybe we can answer relatively quickly, though it's a complicated question. So looking forward, a lot of weaknesses. So COVID has exposed a lot of weaknesses in institutions, in healthcare institutions, in social safety nets, things like that. Do you guys think that there will be positive reforms moving forward, whether in politics, strengthening of local and state institutions, social safety nets, healthcare systems? Do you think there'll be this kind of a positive reaction as a result?
I'm feeling about my case, Brazil, my case, the case I specialize in. I'm feeling pretty pessimistic about that, and mainly because one thing we've seen in Brazil was the folks that were the most hardest hit early on were, wealthier. They lived in, mostly in Sao Paulo. That was the hardest hit city first. They're lighter skinned. They had access to private healthcare. And, of course, as the pandemic wore on, that group, their exposure to the virus declined, their sort of hospitalization rates declined. And then, of course, the more vulnerable sectors of the population, their rates exploded. So you would think that would be the population that would be the most demanding of these sort of kind of reforms that we're seeing. But by and large, what we've seen in public opinion is that they have been responding very, very favorably to the economic measures put in place during the crisis, namely the expanding of Bolsa Familia, who qualifies, but also the size of the payments, the emergency, stimulus payments, expanded unemployment benefits. And though it's in that sector of the electorate that we're seeing Bolsonaro's approval ratings tick up, which to me suggests that they like what they're seeing, not that they want things to change, right? And of course, the conservative bases of Bolsonaro's support, they don't like his response, but they're not going to go out and vote for the PT as a result, right? So I would say I don't see this as a huge shock to the status quo in Brazil.
So I have a pessimist and a less pessimist answer. The pessimist answer for Latin America is everything that I have heard from economists is the economic shock is going to be so severe that it's going to take years to just crawl back, right? So just to get back to where we were, kind of, that's kind of the answer. Even countries that are implementing a generous stimulus package won't be able to sustain them in the long term. So this is true for Brazil. This is definitely true for Colombia. So I am kind of pessimist about sort of moving forward. Having said that, big world shocks have always led to kind of structural to changes in institutional changes in Latin America, one way or another. And so there is that. In Colombia, what I will say is, so Colombia has for the longest time sort of moved around a cleavage on war, right? So how should we deal with the internal conflict? And since the peace process, that cleavage has been fading, but not entirely disappear, because there are groups that are intrinsically interested in keeping it alive. I wonder to what extent COVID and what came before COVID will potentially give the last push to kind of change back to an economic cleavage and perhaps address things that have never been addressed in the political arena in Colombia, like inequality or welfare, or these kind of things that have always kind of gone underneath. So that's my take.
If I have a quick minute, I know we're about out of time. I have two short pieces of optimism for Venezuela in particular. One, it was already so economically devastating before. The opposition and the government were at an impasse. There have been signs of the beginnings of some collaboration in order to access aid that could then eventually and very gradually lead to a potential for compromise and maybe even a transition eventually in the future. And I'll just keep it with that, actually.
So it's 1:30. We'll have to leave it there. I want to once again thank the panelists, David, Laura, and Caitlin, for your presentations, your thoughtful responses to the questions. I want to thank our audience members for their great questions and for participating in this panel, and to the Hinckley Institute of Politics for hosting this forum, and to the staff at the Center for Latin American Studies for also helping to put this on. Thank you very much. I believe there will be a recording of this panel available on the Hinckley Institute's website, so you can reference it in the future. With that, I'll thank you all very much.
Thank you. Thanks for having us.
Bye, everybody.
Thank you for having us.
Thank you.